I am Professor Mirza Akmal Sharif. Today we are going to start with the motor system and first of all the examination of the lower limbs. Keep them in the identical position and see the contours of the calf muscles and the thigh muscles. Second way is to take the girth of the muscle at the identical points on the both sides and compare the two. You can take it over the calf muscles and over the thigh as well. Then we come to the tone. The tone in the lower limbs is checked at the 2 points. One is over the ankles and second is over the knee joint. Over the ankles, hold the lower part of the leg, shake it gently and see the movement of the foot, whether it freely moves from to either side or there is some resistance. If there is some resistance and does not move freely, then you will say that the tone is normal. Then you check the tone at the knee joint. For the knee joint, ask the patient just to relax the limb, passively move it, flex and extend it, and feel the resistance, slight resistance if present, that indicates the normal tone. It may be increased or it may be decreased. Increased indicates the upper motor neuron type of the lesion. When you have assessed the tone, then observe for the fasciculations in the calf and in the thigh muscles. If there are no fasciculations, you can induce them by tapping the muscle like this over the thigh and over the calf muscles. The next is the assessment of the power in the legs. If you ask the patient to lift the leg in the air, if somebody is able to do it, that indicates the 3/5 power. The grades of the powers are like this. If there is no movement at all, the power is 0. If there is a flicker of the movement, then this is 1. If the patient can move the limb horizontally like this, gravity eliminated, this is the 2/5. If the person can elevate it in the air, then this is 3/5. And if the person can apply the resistance but it is not normal compared to the other side, then you will say it's 4/5. And if the full power is there, it will be 5/5. The power is assessed at the level of the toes, ankle, knee, and the hip joint. Over the toes, you check for the dorsi and plantar flexion. To check the power at the toes, you place your hand over the dorsum side of the toes and you ask the patient to apply the force on your hand and dorsiflex the toes. इनको ऊपर को जोर लगाओ like this. For plantar flexion, place your fingers over the plantar side of the toes and ask the patient to plantar flex the toes. नीचे को जोर लगाएं like this. Then you come to the ankles. For that, you place your hands over the dorsum of the foot and you ask the patient to dorsiflex the foot at the ankles. इसको ऊपर को पैर उठाओ ये. Then place it over the plantar side and ask the patient to push it with both the feet. नीचे को जोर लगाओ like this. After the ankles, you come to the knee joints. The knee joint is a bit tricky compared to the ankle joint because the movement over the knee can be a combination of the knee and the hip joint as well. So for that, you have to immobilize the hip joint before you check the power. And another thing which is to be kept in mind is that whenever you have to check the power or you have to do the reflexes, the joint should be at the mid position. So you slightly flex the knee joint at about the mid position and you ask the patient to flex and bring it close to the thigh, but the force should not be applied over the thigh and you have to immobilize it. Hold it, immobilize it and ask the patient to bring it down. इसको नीचे को जोर लगाओ like this and apply your force to check the power. Compare it with the other side. Then hold it, immobilize the thigh and ask the patient to raise the leg. इसको ऊपर को उठाओ, जोर लगाओ like this. So after doing on this side, compare it with the other side. And if both are equal, you will say that the power is equal at the level of the knee joints. To check the power at the hip joint, keep both the legs straight. Place your hand over the dorsal side or the front side of the lower part of the leg and ask the patient to raise it. इसको सीधा ऊपर उठाओ like this. Now the नीचे को जोर लगाओ. This is extension at the hip joint. Keep your hands on the outer side of the legs and ask the patient to abduct them. इनको बाहर को खोल like this. This is abduction. Place your hand on the inner side and ask the patient to bring both the legs close together. इकट्ठे करो जोर like this. So this was abduction and adduction. Then is the internal and external rotation. Hold the feet and ask the patient to rotate them outwards. बाहर को घुमाओ इनको like this. And for internal rotation, place your hands on the inner side and ask the patient to rotate them inwards. अब अंदर को घुमाओ like this. The only movement which is left is the hyperextension. For that, turn the patient to the one side, straighten the leg and ये टांग सीधी करके पीछे को लेके जानी है, सीधी 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 पीछे को like this. So this is hyperextension. Before doing the plantar reflex, the prerequisite is that you should check the movement at the first metatarsophalangeal joints, whether it is orthodesis is there or not. Is it freely moving? Then you have to hold or grab the foot of the patient so that you can prevent the withdrawal of the foot during the reflex. The object should be pointed but blunt, and you have to scratch on the outer border of the sole and then bring inwards. And wherever you see the response of the big toe, you stop over there. So you start from here with firm pressure. As soon as you see the movement of the big toe either down or up, you stop over there and then you compare it with the other side. The next is the ankle jerk and the knee jerk. The root values you should keep in mind. Before doing the ankle reflex, just ask the patient to relax the muscles. Check whether the person has relaxed the muscles or not. After that, slightly flex at the knee joints. You hold the hammer like this. The hammer is to be held not from the distal most part. It is slightly lower downward. Hold it from here, and when you are doing the reflex, give a thrust to the hammer and then let it fall with its momentum and strike the tendon. It should be preferably at right angle striking to the tendon so that it does not slip away. Check whether the muscles are relaxed. Your hammer should be striking at right angle to tendocalcaneus. And this contraction of the calf muscle was the positive reflex. Again, look at it. So this is to be observed. Similarly, do it on the other side and compare whether the reflex is equal or not. This reflex can be diminished normal, or there might be hyperreflexia. Whenever there is hyperreflexia, you have to check the ankle clonus as well. To check the ankle clonus, flex the leg at the knee joint, hold the foot of the patient, move it like 2-3 times, and then sustain some pressure. And if the foot starts moving like this, you will say that the ankle clonus is present, which is a sign of hyperreflexia. Then you come to the knee joints. For knee joints, you can do the knee jerks in this same position, or you may do it like this by holding or placing your hand under the knee joint, feel the tendon, and then strike it with the hammer like this, and observe the thigh muscles for their contraction. So this contraction, presence of contraction, is the positive sign. This contraction indicates that the knee jerk is positive. Similarly, on the other side, if you are unable to elicit the reflex, you might have to do the reinforcement. And the reinforcement, whenever you do it, it lasts only for few hundred milliseconds. So your command should be very precise and to the point. And the command should be to the patient that clench your teeth or apply the force with your fingers when the hammer strikes the tendon. It's very important. Ask the patient to clench the teeth when the hammer strikes the tendon like this. जब ये लगेगा उस टाइम पे दांत जोर से दबा के छोड़ देने हैं. So and you will get the reflex. If there is hyperreflexia, then you have to check for the patellar clonus as well. For the patellar clonus, hold the patella like this, give it 2-3 jerks downward, and then hold the pressure. And if on continuous pressure the patella starts moving like this, you will say that the patellar clonus is present. After you have checked the power, you check the coordination in the legs. And for that, first demonstrate to the patient what you are going to do. Place the heel over the front of the other leg, scratch it downwards and close to the ankle joint, lift it, bring it back, and again place and move the heel downwards up to the ankle joint. करो शाबाश. ये पाँव ऊपर उठा के ऐसे. हाँ. So you place the heel, move it downwards over the ankles, lift it, and again come back, and again come back and scratch it again. So if it is normal, compare it with the other side. And the coordination is only possible if the power is more than 4/5. After this, you have to observe the gait of the patient as well. Why we do this motor system? Whether there is a lower motor neuron lesion or an upper motor neuron lesion present. And if present, is it unilateral? Is it bilateral? And then we have to extend our examination to find out what is the level of the lesion. So in the exams, when you are asked to do the motor system in the legs, and the command is usually that examine the motor system in the legs and you can extend your examination if you have the time. And this extension only means that the same examination should be done in the upper limbs and then for the cranial nerves, so that you are able to find the level of the lesion. This much is for today. Thank you.